Hello, everybody. House Shrink. Once again, giving you another taste of psychology, good thinking, and an opportunity to ask questions. And today, I think you're going to love it because I'm going to talk about a subject that's very popular. A lot of people ask about it. And it's going to be just questions and answers, questions and answers. And I'm going to wait till people come in. We always have thousands of people. If you see it, you might see 50, 60 at a time, but at the end it shows the cumulative, and we've had several thousand every time, so it's quite a few people. So if you just joined, House Shrink. And I'm going to be talking about today, actually it's going to be questions and answer, Q&A, about the psychology of fear. Fear. Is it learned? Is it innate? And I'm going to be talking about how to deal with it and how to look at it into yourself, what the research says, and what is the psychology of fear. So that's what we're going to be talking about. But what I'm going to do is, rather than give a lecture, as I usually do, I'm going to give you an opportunity to ask questions about fear. Stay with the subject. Don't go out somewhere because that's not going to work. And clowns are not welcome today. We don't want clowns today. We want people to pay attention because fear is something that is serious, something that needs to be looked into. And that, so we're going to leave religion out, politics, and clowns. This is about fear, the psychology of fear. Okay, so don't ask me about religion, don't ask me pronouns, don't ask me anything politically correct, because I'm not going to be talking about that. I'm going to be talking about the psychology of fear, and to give you an opportunity for you to ask questions about it. So that's pretty good. Good deal. All right, so House Shrink here, talking about the psychology of fear. Am I qualified to talk about it? Yes, I am a licensed clinical psychologist with a hell of a lot of experience working with thousands of people with fear, phobias. My research has been in phobias, and so quite a bit of work here. So I have a lot of experience, and I want to share some of that with you to help you. And the whole idea is to help you. But we want to be able to do it with people who are interested in learning about themselves. It's all about selfhood. So here, again, I'm going to be talking about the psychology of fear. Is it learned? Is it innate? And then I'm going to give you an opportunity for you to ask questions. Any particular questions about you or in general, and I'll try to answer them for you. So let's start now with the psychology of fear. The question is fear learned or is it innate? You're born with fear. The good news is that 99.9% of fears are learned. There are a few exceptions. And the way you look at it is with infants, newborns, and you check the heart rate, and that's how you begin to, because fear, the first thing that happens when you're afraid is your heart rate goes up. And what has been found so far is there's some innate fears, and one is when you look at a snake or a spider, the infant's heart rate goes up. So that's an epigenetic transfer from many, many generations that snakes need to be feared because some are poisonous and can kill you, and so can spiders. Then there was an experiment done. The very few fears are innate, very, very few, and I'm going to try to clarify that for you. The studies that were done before by Gibson and others, and it's called the clift. And what they did is they put, let's say, two tables about 10 inches apart, and then they put a see-through glass or plexiglass over the tables, so it would look like a cliff, but there really was you could cross. But the question was depth perception. Is there an innate fear about falling, or is it learned? And for many, many years, it was thought that the cliff experiment, that was it, that children are born with that innate fear of depth and falling and hurting themselves. But later studies, what they did is they looked at children who were younger. They had not had an opportunity to learn about depth perception. And children from 2 to 5 months old did not have that heart reaction. What they had is a curiosity, and they went through and they walked through on the transparent plank. So much for the cliff fear. Very, very few fear. Very few. I argue that 99% of them are learned. And a fear can become something functional. You could have a fear of people that have hurt you before. You could have a fear of someone coming to you with a gun. Those are functional fears. That's a protection fear. But if you have a fear that is not functional, it's not a fear that you think that anytime you go out, somebody's going to come out with a gun, then that fear can turn into a phobia. And what phobia means is a fear that begins to interfere with your life. That you won't go out of the house because you're afraid of being robbed, or you don't. And in some neighborhoods, you really have to be afraid. But in general, it incapacitates you. I've done a lot of work when I was a graduate student at Vanderbilt and other places, and then later in my practice on anxiety and on phobias. And the thing about it is that if you have a phobia, by definition, is incapacitating you from life. It doesn't allow you to function. If you have a fear of heights, you will not go on an elevator, or you won't go up to the third, fourth floor. So it incapacitates you. It obstructs your usual normal living. That's a phobia. So fears are learned. Fears are learned. You learn them two ways: by experiences, and also by what you're told by the historians, and also epigenetically. You pass it on from one generation to another. So if you learn a fear, you ask yourself, did I learn it by my experiences, or was I told to be afraid of this? So don't go out in the rain because you'll catch a cold. Don't talk to strangers. At first it's good. When you're a child, you don't talk to strangers because there are a lot of child molesters, but later you realize that that's okay after a while, that it's okay to talk to strangers and find out what type of strangers you want to talk to. So you ask yourself, did I learn the fear by my experiences, or did I learn it was passed on generation by family and the stories that are told? And the stories that tell you your cousin was bitten savagely by a dog and he almost died. Well, that's a learned fear. Then you develop a fear of dogs. That is a learned fear. It's called a vicarious fear, learned by the experiences of others. And you could even have post-traumatic stress disorder, PTSD, vicariously by watching someone getting hurt. You can have PTSD by watching an accident, even though it's not yours. It's a vicarious experience that is turned into a fear. So now, if you have any questions, let me stop talking about fear. Don't deviate. Don't play games, because this is serious. Respect the audience and respect me. So if you have legitimate questions, please ask them, and I'll try to answer them for you. Be specific so I can answer them for you. Meanwhile, I'll drink some water. Okay, go ahead with your questions. I'm talking about fears. Are they learned? Are they innate? And they're 99% are learned. And there are ways of unlearning them. Anything that you learn is unlearned. The first thing that happens with a fear, CPTSD, what do you mean by that? What is CTPSD? Have you ever heard of tryptophobia? Yes, I have. So tell me specific what you want, not what I know or don't know. And if you have a question, ask me. Don't give me questions about do I know this, do I know that. Just ask me specific questions, and that way I can answer them for you. All right. Let's see. I'd like to ask, though, is exposure the only fix? Exposure to what? Be specific, please, because I can't read your mind. I'm trying, but I can't read your mind. So be specific, and I'll try to answer them for you. So the learned fears, you have to ask yourself, are they functional? What can I do about the fear of the current vaccines? Okay, that's a very legitimate question. Complex post-traumatic stress disorder, yes. Post-traumatic stress disorder is post-traumatic stress disorder, and so we don't want to confuse it. I've done a lot of work with post-traumatic stress disorder. Complex, they're all complex. Okay, so let me go to the fear of vaccines. The first thing that you do with any fear is you educate yourself. When it comes to vaccines, ask yourself, okay, there are 3 major vaccines. There's Pfizer, and there's Moderna, and there's Johnson & Johnson. Let me look at the statistics. Let me look at how much research I have done with it, how many of the clinical trials. Let me look at what people say about the reactions that people have. There've been some deaths. So then you ask yourself, and in medicine you always ask the risk-benefit factor. What is the risk and what is the benefit? And then you have to make that decision yourself. you have to make the decision that you either take it and, and have the consequences, whatever they are, because the risk is not as high as the benefit, or you say, well, no, the risk is a lot higher than the benefit, so I'm not going to do it. So it's a very personal thing, but educate yourself with professionals. Educate yourself with professionals, and then make a decision. And whatever decision you make, be at peace with it. And that's how you deal with fears. But also, you have to do some desensitizing and some work on it. But intellectually, that's the first thing you do. Be an informed consumer. Let's see. I risked coming to this channel. The benefit was I became so bored, I also fell asleep. Well, then you can leave. Go. If you're not interested, you can go. I'm glad that you fell asleep. That's good. You probably had insomnia. Okay, now you see that how the cuties are coming on because they're not serious. These are people. Hi from Japan. Hello. Konnichiwa. They're not serious. They just want to be clowns. They don't have much upstairs, and they just want to come in and be clowns. So I missed you on TikTok all week. Well, thank you. I'm glad you're back. And hi from Manila. Oh, I've been to Manila many times. Beautiful country, beautiful people. So I want to ask you. I want to ask you again because I'm respecting you. To then ask me questions. Why doesn't the VA for veterans have counseling like yours? They do have some. Maybe it's not as good as mine, but I have seen a lot of veterans from Vietnam, from the Iraq War, and I've done a lot of work with them. But the VA does treat it. It depends on, again, the doctors. You might go to a VA hospital that has a really good doctor, another one doesn't, so it's very difficult. But veterans need to be treated with post-traumatic stress disorder. Hello from Germany. Hello. I've been to Germany, to Cologne. It's a beautiful place. And I'm going to Germany probably next month to outside Stuttgart. So anyway, what's your job title? I don't have a job title. I'm the founder of Biocognitive Science, and I'm a licensed clinical psychologist. So I guess, I don't know, that would be my title. That's why I call it House Shrink. I'm the House Shrink. So post-traumatic stress disorder started in World War II and World War I. They didn't know what it was. They call it shell shock. And it wasn't treated. It's just you shell shock, you get over it. And there was tremendous incidents of suicides, alcoholism, gambling, family abuse, because these people didn't know how to deal with it. And that was actually post-traumatic stress. Then in the Vietnam War was the first time that they actually looked at it and said, okay, how can we deal with it? What is it that we have to do? 2 books. Yes, I have 2 books. It's called, the titles are The Mind-Body Code and The Mind-Body Self, and they're both bestsellers, and they have a lot of information about fears and phobias and selfhood and all that. Is there a way to conquer the fear of heart stress tests? Well, what you do is you if you're going to have a stress test, one of the ways you do it, always check with your cardiologist first. But if everything's okay, then do walks, do power walks for 10 minutes, 15 minutes, whatever. And then when you have your stress test, you'll fly in colors. The best stress test is the walking or the swimming or the jogging or whatever. But always check with your cardiologist to make sure that you can do it if you don't have any problems. Okay, so what are your thoughts on the LGBTQ community? That's not science, that's just political, so I'm not going to talk about that. My belief is that I believe in people, not in their sexual preference. If you're a good person, it doesn't matter what your sexual preference is. If you're a bad person, it doesn't matter what your sexual preference is. And I value people by who they are and what they do, not by their pronouns. Oh, hello from Liverpool, the land of the Beatles. Wonderful. This is really great. How to stop compulsory skin picking? Well, you have to, there's a desensitizing techniques that you can do, but you also have to find out how you learned it. It had a function, it had an initial function. And usually these things have to do with reducing anxiety. Hello from Oklahoma. Sometimes we do things that are dysfunctional to reduce our anxiety. Sometimes people will cut themselves. They self-injurious behavior to reduce their anxiety. But obviously that's not a good way. So first you have to find out what the function was initially, and then there's some techniques. You can read my books, you can get therapy from other people, I can do consultations, but Why is gambling bad? Well, I'll tell you why. Because just to give you an example, Las Vegas was a desert. Now it's a multi-billion, trillion-dollar company or city built on the statistics of gamblers. Gambling is always the statistics is always on the house, not on the gambler. You win, and now here's a gambler's flaw or an illusion. Gamblers will say, okay, if I gamble long enough, if this one, let's say, has a 40-50 possibility of winning, if I do it over and over and over again, the probability will go up, and it's not. It's a statistical flaw. 40-60, only you do it 1,000 times, it'll be 40-60, 40-60, 40-60. But that's the gambler's delusion. How do you stop biting your nails? Find out what it's doing for you. It's reducing your anxiety. How did you learn biting your nails? When did you start biting your nails? Maybe your parents said, bad little girl, and you started biting your nails, and it reduced the anxiety. Have to learn about it. Go back. Always find out, because things have an initial function. Later, they lose the function, and it becomes a problem. What is the connection between gambling and trauma, PTSD? Sometimes PTSD, when people try to deal with it with themselves, because post-traumatic stress disorder is a terrible thing. Your heart rate goes up, you think it's the end of the world, you begin to relive the experience, all kinds of things happen. Get depressed, and then gambling, or sex, or porno, or something can be distractions from the post-traumatic stress. And then it becomes an addiction or a compulsion, and that's the problem with it. The veterans get no help here. Well, that's terrible. I think that needs to be, the veterans need to be treated with great respect. What the term you talked about where fear can be carried on? Oh, epigenetics. Yeah, epigenetics is that it was thought up to about 90 years ago that you can only transfer traits and you can only transfer information DNA-wise, and that took many thousands of years. It was found epigenetics, which means above genetics, that the environment can actually change not the DNA, but gene expression. The environment can affect gene expression, your gene expression as well as your children's gene expression. And I always use the example of people who were in concentration camps, both in the Soviet Union and in with the Nazis, and they pass on 2 or 3 generations the level of stress hormones epigenetically, not through the DNA, but through the gene expression. The good news is that epigenetics can be changed. Whatever you learn epigenetically can be reversed in many cases. Fear can change the gene expression. Yes, you can teach your body a gene expression when there's fear, and what it does is it suppresses the immune system, and it can actually trigger family illness, and that doesn't mean that it's causing it. It increases the probability, so it's very important. Can you advise on grounding? I'm super panicky and get physically sick. I'm going through a breakup. I have several videos that you need to go to on unrequited love, the end of relationships, and my books have a lot of information about that. And remember, here I am doing more than 60 seconds, obviously, up to an hour or more, and you can't post it on TikTok, but they give us the option to put it up on other social media, which I do. All of these videos will go on my YouTube channel, which is Dr. Mario Martinez, so you can watch that later. But one of the ways to ground yourself is to stop, sit, check your body, see where it's tension, and pay attention to it. Don't try to get rid of it. Pay attention to it. Sit against something that has solidity, like a solid wall. If you're, don't put your back to a window or to a door, because that comes from epigenetically transferred from the cave days. You don't put your back to the cave because you become some animal's lunch or the enemy. So that's the first thing you do. And then what you do is you watch everything that's happening. You have thoughts, you have fear, and you watch it as if you're watching a film. And then you pay attention to your breathing. Pay attention to your breathing. It's going to be a little scary at first, but then let it pass. Call them clouds. A thought comes in, there's a cloud. Another thought comes in, there's a cloud. And gradually you'll start grounding yourself. Would you mind answering, please? Is Anuska, what is Anuska? Oh, ayahuasca, you mean? Ayahuasca? Well, if you mean ayahuasca, ayahuasca is a hallucinogen, they call it a plant medicine. And what it does is it it expands the concept of selfhood when you're under the ayahuasca. It should always be done with professional help and where it's legal. But what ayahuasca does, it can shake up some of the constriction of the post-traumatic stress disorder, and it's been used clinically and professionally to deal with post-traumatic stress disorder. But I would not use ayahuasca alone. Psychotherapy is very important because there's a learned process that ayahuasca is or nothing, any of the hallucinogens, whereas peyote or anything else. So do it under professional supervision and then with additional help, because sometimes with post-traumatic stress, if you do hallucinogens, it can disrupt quite a bit. It has to be done with professionals. So yes, it's been used with depression. It's been used with post-traumatic stress disorder, dissociative problems, but psychosis, not at all. Do not use it if you have psychotic tendencies or psychotic probability, because it can be very dangerous. It should always be used under professional supervision and in a place where it's legal. How do you find calmness and normal during these times? Anxiety and stress is very real. Anxiety and stress are interpretations of events. Interpretations of events. Something's happening out there. It's raining. Somebody says, oh, what a shitty day. Oh, what a mystical day. It depends on the interpretation that you make of things. There's no such thing as stress out there. It's the interpretation of the stress that you make. But if you interpret it in a particular way, find out how you learned it, how you learned to interpret stress that way, and how you learn and what are the conditions that cause stress for you. Let's say you have a boss who's from hell, and that he or she treats you badly. Find out under what conditions it happens. Find out if you can talk to that person and deal with it in a reasonable way. And if you can't, I would say give yourself 6 months and get the hell out of that job, because it'll make you sick. That's the, sometimes you can change some things. I heard you get sick with ayahuasca. Yeah, you can get very sick. You can have, I did it under supervision once. I didn't get sick. Nothing happened to me because I've done a lot of work in other areas. But yeah, a lot of people vomit and diarrhea, and it could be a pretty difficult problem. Social workers, psychiatrists, psychologists, who do you recommend I see for therapy? Depends on what kind of therapy you're looking for. What is it? What is the problem that you're dealing with? And then I might be able to tell you where to look. Talking is helpful for many, not for me, because talking is not enough. You have to have methods of mind-body method. Talking doesn't do anything. If I tell you, look, don't be afraid, you're strong, you're bigger than that spider, that doesn't work. That's intellectual. That's why my work, biocognitive science, is mind-body culture embodied, not talked. So let's see. Okay. I know Jesus loves me. I don't need to be reminded. It's okay. Or the Buddha loves me. All good entities love me. So no need to be reminded. It's okay. And thank you anyway. But remember, no religion, no politics, and no clowning. That's it. I'm not asking for a lot. I'm giving a lot. All I ask is, oh, by the way, please follow my work. Go and click the follow. It's very, very important. Wish you were in California. You're an amazing therapist. Thank you. I do consultations online, by the way. A limited basis, I do consultation online, and I work with individuals from all over the world on Zoom. I'm not sure what my root of the problem is besides childhood trauma. You have to look at when it happened, and you had a natural response to what happened when you were traumatized, and that's a natural response that was necessary, very necessary, but then it loses the function when it's no longer there. The threat's no longer there, and you're acting as if the threat were there, and that's when it becomes dysfunction. But again, the point here is that fears are learned, and you have to find out if you learned it from your family or if you learned it by your own experiences. And the only real fears are when you're born. The only fear is when you see a snake, you're curious and your heart rate goes up, so there's a little bit of a epigenetic transfer that snakes can be dangerous, or a spider can kill you. Or, by the way, the color blue reduces appetite. The color blue reduces appetite because there are things in the forest that are blue that are poisonous. So we've learned to stay away from the blue. But now you have blueberries and other things. But blue in itself reduces appetite. So if you want to eat less, be around blue. If you want to eat a lot, which if you have an eating disorder, I wouldn't recommend it. A salmon color is the one that increases your appetite. Blue decreases your appetite. Thoughts on psilocybin for PTSD? Again, psilocybin is an extraction from mushrooms. It has to be done under supervision, under psychiatrist, psychologist, someone who, mental health person, and it has to be, because the dosage has to be correct, and then the person has to be treated. Sometimes you come out very disorganized from psilocybin or from LSD or mescaline or ayahuasca, and you need a professional to help you. So never do it by yourself. Always a professional, and always when it's legal. I think I'm not sure. I think you're playing make believe in order to profit from misguided. Can you unpack that to see what you're saying? Epigenetics are harder to change with age. No, not at all. No, I have talked to centenarians, people who are over 100 years old, who have had epigenetic changes. It happens. Age doesn't do anything. Age doesn't do anything. It's harder, a little harder, because you have more time having done it wrong. But anything can be unlearned at any age. I can tell you that because I've worked with centenarians all over the world, people who are over 100 and healthy. So if you have serious questions, go ahead and ask them. Anyway, I'm talking about fear, how it's learned. How shrink. I'm asking you to follow my work. Go click and follow my work. And tomorrow, you'll be able to see this in its entirety on my YouTube channel, and it's Dr. Mario Martinez. We have a, anyway, I'm not going to get into it. There's some people trying to be a clown. I'm fascinated by people who are distractors. Fascinated. And the reason is that the distractor people are people that can't be serious. They can't take a topic. They have to be cute. They have to be funny. They're avoiding whoever, whatever it is, but they just have to be the clowns. And it's fascinating to me that you're getting something here free, that it's from a professional, and you have to play your little mind games. So we got a moderator, and the moderator is cleaning it up. But thank you so much for suggesting. I'm trying to help my 6-year-old grandson recover from fear and trauma. I would suggest that you have a child psychologist or a developmental psychologist work, because there's a lot of play therapy that you can use, and you can help tremendously. No, I have a moderator already. Thank you very much. Samantha's a moderator, and she does a great job. And sometimes she'll answer questions that I didn't get a chance to, because she's trained in biocognition. So she'll try to answer some questions for you. And of course, but thank you for suggesting to be a moderator. What you need to do is people like that who come on as clowns, block them and mute them. Just block them. And they'll have an audience of idiots that they can go to, and the idiots can laugh. So this is serious, because fears are very serious, phobias are serious, anxieties are serious, and they take you away from your joy. Do you believe in anima and animus? That's Jung's theory of the different archetypes. Anima is the femaleness, not sex, the femaleness of an individual, and animus is the maleness of the individual. And he did a lot of good work with that, and he talks about it's quite complex to talk about it here, but basically is the archetypes that we all have. He says that we all have a femaleness, not sexual, a femaleness as symbolic and a maleness as symbolic, and those two needs to be balanced with the shadow. So he's quite complex. So I would suggest that you read some of his books. How about anger? Any fix for that? You learned anger. Anger is learned. How did you learn it? Under what conditions? And ask yourself, are you angry because of any of the 3 archetypal wounds? Are you angry because you've been shamed, because you've been betrayed, or because you've been abandoned? And each of them has an antidote. Watch my videos. I have videos on the archetypal wounds, and anger can be treated, can be conquered, and you don't need to let it ruin your life. Somebody mentioned the Monique about the mind-body code. That's my book. Thank you, Monique. Yes, there's a lot there that you can get. But anger is learned, and it can be unlearned. May I ask about your education that you stumbled? I'm a clinical psychologist. My doctorate is in clinical psychology. Went to Vanderbilt, the University of Madrid, postdoctoral work at Fairleigh Dickinson on psychopharmacology and many years of experience. I've worked a lot with people who are over 100, and I'm the founder of Biocognitive Science. I'm a licensed clinical psychologist. My specialty is psychoneuroimmunology and neuropsychology. I'm so glad I'm FYP. Great, I'm glad to hear that. People that are joining us, we have thousands of people that join us. I just want you to make sure that you follow my page, follow my channel, because that expands the audience and it allows you to know when I'm on, and allows me to reach more people. Samantha was saying about, I have a monthly group also that I do, and this is charged. It's not very expensive. It's $75 a group, and we have only about 14 to 15 people, and it's first come, first served basis. Go to my website. It's on my page, biocognitive.com, and look it up, and you will see that there's the groups get filled up very quickly. So if you're interested, go ahead. Do you use meditation in your practice for your patients? I do, yes. I teach more than meditation, contemplativeness, which goes beyond the meditation. What other languages do you speak? Spanish, Portuguese, and French when I drink good French Bordeaux. Any fix for alcoholism? Yes. I have articles, and in my book I talk about it. My personal professional opinion, alcoholism is not a disease. It's not a disease. It's a learned behavior. It's a culturally learned behavior. And there's a lot of physiology and a lot of genetics, but it's not an illness. I understand all about serotonin and dopamine, all of that. It's not an illness. It is a situation where you have learned dysfunctional behavior to deal with your own selfhood and to deal with other things. But there's no question that there's a genetic component, there's a physiological component, and there's an environmental component. Any advice for panic attacks? Yes, read my books. And for panic attacks, what you have to do is you have to, there's some techniques that you can use, desensitizing techniques. I would suggest that you get professional help, but also read my books. And what happens with alcoholism, for example, even professionals don't even know or care about the difference. Look, there's compulsion, obsession, and addiction. When you watch television, you don't have an addiction to television. You have a compulsion. When you have thoughts in your head that you can't get out of your head, you don't have an addiction. You don't have a compulsion. You have an obsession. So let me clarify that here. Alcoholism is rampant in Alaska, yes, and in many, many other places. It's a way of dealing with things that you feel overwhelmed. So, okay, what is a compulsion? A behavior that interferes with your life that you have difficulty getting rid of. What is an obsession? A thought that interferes with your life that you have difficulty to get rid of. What is an addiction? A substance that you ingest, and that substance gets to a point where you reach an addiction, and then you have withdrawal symptoms, and you have to get more of the substance to reduce the withdrawal symptoms. The longer the half-life, the less addictive. The half-life is how long it takes for 50% of it to get out of your system. So, for example, cocaine is highly addictive. Alcoholism is less, but it's also addictive because cocaine doesn't last very long. Alcoholism will last longer. Marijuana will last longer. But they're all addictions. If it's a substance, you don't swallow a television. So when you're watching television, it's not an addiction; it's a compulsion. It's very important. Man, I wish you taught college. I did. I did teach college classes. And what's happening? Let me talk about college. Many of the professors are full of shit. They have no backbone, and they force you to think the way they want you to think. They don't teach you to think. And you have to teach people to think and to disagree with you and to have the backbone to be able to disagree without putting you down. But political correctness doesn't allow that because they'll label you right away, and that's it. And there are professors that will actually fail you if you disagree with them. I think that's ridiculous. I love your glasses. Thank you. These are John Lennon glasses. So I appreciate it. Especially in the U.S., absolutely, especially in the U.S. Political correctness is a cancer. It's fascism, it's intellectual fascism. And I've done some talks on that, so please go to my videos on that, and you'll see how political correctness is just terrible. And I teach how to get out of it. So anyway, House Shrink here, talking about fear and how to deal with fear. Is it learned? Is it innate? And it's learned. 99% of it is learned. But please go ahead and click follow, because that's what I need so I can expand the audience and people know when I'm here so I can help you. This is free. This is for you. I am respecting you enough to put my time here to talk to you. So all I ask you to do is just to follow. And then if you want to see the whole video, you like it, then watch it tomorrow on YouTube, Dr. Mario Martinez. Boy, are we on the same page with PC. PC is the biggest intrusion on freedom. It goes against individualism. Oh, by the way, I want to teach you a new word for the people that are always labeling you homophobic, racist. If you say something and you're not a racist, they'll call you a racist and you're done. Because who wants to be a racist? Who wants to be a homophobic? That's their strategy. You know what they are? I had to invent the word. For example, misogynist, it all comes from the Greek. Misa means hatred, and Jenny, from gynecology, Jenny means woman. So misogynist is a hater of women, and that's one of the labels they give you. The label that I would give them is misatomist. What does that mean? Misa, hatred, atomist, individual. They are haters of individualism and haters of the individual. So there you go. Misatomist. Let's see. Okay, favorite books. Well, my books. The Mind Body Code and the Mind Body Self, because I wrote them and I know they're good. But I also love a lot. I love philosophy. I love Aristotle and Merleau-Ponty and many, many great minds out there. But if you want to start with some good books, start with mine. Bestsellers on Amazon, The Mind Body Code, Mind Body Self. And they're on my page. You can see the names on my page and you can go to Amazon. Do you think the news on COVID is affecting more people with anxiety? No question about it. It is, yeah. It's causing a lot of... And by the way, when the news causes fear, it decreases your immune function and makes you more prone to catching not just COVID, but anything that's out there. So what you want to do is you want to learn, become very acquainted with the information and reduce your fear by the techniques that I talk about, because anytime there's fear, you're secreting hormones, cortisol, norepinephrine, epinephrine, that actually suppress the immune function, and it makes you more prone to catching whatever's there. So, okay, let's see. More questions. If you just joined, this is House Shrink. A lot of people, we have thousands of people that at the end that showed up. Oh, by the way, some people give me diamonds. I didn't know what that was. I think diamonds is some credit or something. So I had no idea. So those of you who have given me diamonds, thank you very much. Whatever that is, thank you. So anyway, any questions? House Shrink. First thing to do is to go ahead and hit the follow. Hit the follow button. All right. And anyway, how do animals sense danger before humans? That's a really good question. Animals have more of reflex because they don't have language. We lost a lot of our sense reflexes with our language, because an animal has to smell a predator 100 meters away. A human being can say, hey, 100 meters away, there's an animal. So we lost a lot with the language, but then the language becomes symbolic. So animals go by their senses because they don't have a language. They can't say, hey, don't do this. They have to have, so it's a preservation that they have. We lost it with a lot of it with our language, but the language became in itself an extension of our senses. Maybe the press should focus on boosting the immune system. No, I'll tell you why, because it doesn't sell. What sells is fear. Most of the press are just news whores. They just want to sell you something at any expense. Even when they talk to you, they go, the latest news. They give you this draconian face, and then they give you some bullshit. That's what it's all about. They're whores. If the press were responsible, they would give you a balanced view. Okay, COVID is this, and this is what's happening, and this is how you can protect yourself. And we know many, many people who have made it through. And COVID, by the way, the deaths, a very large percentage, have been with comorbidity. People that had other illnesses that already had a compromised immune system or a heart or something, and then COVID comes in and it affects you even more. So I will be talking, and I have talked about this quite a bit. Samantha just mentioned the three pillars of self-esteem. Go to my video on the three pillars of self-esteem. I've had over 26,000 views already, because it really talks about the importance of self-esteem, the three parts of self-esteem that nobody talks about. Press are just political tools. Yeah, for the most part they are. You're absolutely right. And for right or left, they're tools. And that's why they're whores. The pimps are the political parties, and then the whores are the ones who give you the information. That's the way I see it, in my humble opinion. Okay, but let's stay with fear. Questions about fear. Fears are learned, 99%, and they can be dealt with the proper treatment. What is your name again? I'm house shrink. My name is Dr. Mario Martinez. I'm a clinical psychologist. And Glenn, go ahead and follow. It's very important that you follow. What am I talking about? I'm talking about fear, whether it's learned, whether it's innate and it's learned, most of it. And I'm talking about specific issues with fear, how a fear becomes a phobia, the different kinds of fears that people have and how to deal with it. But what I'm asking, oh, good, Rusty is following. Is fear and anxiety the same? Anxiety is one of the components of fear. Anxiety is a physiological response, and so is fear. So when you have fear, this is the physiology. Your pupils expand, so you can see more of the environment. Your heart rate beats, so you can fight or flight. Your blood pressure goes up, fight or flight, and your immune system suppresses, because whatever it's doing, fighting pathogens or digestion, it says it's more important to fight or flight, and then later we'll come back and we'll continue to fight or deal with the digestion. This is why when you have bad news while you're eating, you have a problem with either up or down, because it's affecting your parasympathetic reaction. I have social anxiety. Well, what is your social anxiety? What is the LOL about it? Oh, will I talk about social laughter? Yeah, let me talk about social laughter. This is really very good. If it's just, no, I don't use a DSM-5. I don't like to code people. I like to look at people as individuals. I used to use it when I had to do insurance companies, but I don't anymore. I don't like to label people. And it's interesting that that each year the DSM gets thicker and thicker, more illnesses. Jordan Peterson said, you overcome fear not by stopping to fear, but by becoming stronger. Yeah, that's true, but you have to learn how to become stronger. You just don't become stronger by, I'm going to be stronger. You become stronger by evidence. I'll give you specifics here. You have been courageous. You have been afraid like anybody else. In your memory archives, you have memories of courage. Bring that out. Embody it. See how it feels to be courageous. And then for the rest of the week, do small courageous things that nobody knows about. You're creating neural maps of courage. That's how you deal with it. Specifics. I think he's right. I think what I'm giving you here is tools. A little bit of anxiety. I couldn't read that one. Can you? Oh, back to social laughter. Yeah. Okay. Duchenne was back in the, I think it's the 19th century. He was able to do things that you can't do now because it would be unethical, and I would understand. Is that he would wire prisoners and people that were considered expendable, which is terrible, but that's what they did. And then he would wire people to see what was a real laughter. And he found that the real laughter, what they call the Duchenne laughter, is the one that you're like that, crinkling here and your lips going up. That's the real laughter, and it comes from the stomach. Social laughter is to reduce anxiety. You walk into a restaurant and you say, well, it's raining. Oh, yeah, it's raining. And so, the hell is raining? Rain's not funny. That's social laughter. It usually comes from the top. And when you hear social laughter, it's annoying. When you hear the Duchenne laughter, it's contagious. You hear somebody laugh and it's contagious. But if you hear, that's not real laughter. And many politicians will do that, by the way, the social laughter. What a beautiful kid, ha, ha, ha. What's funny about a beautiful kid? And anyway, the kid wasn't that beautiful, so you see? When you get into the car, high heart rate, yeah, because what happens is that the fears are associated with the context, especially if you have post-traumatic stress. It's associated with the context in which you learn post-traumatic stress. So if something happened to you with a car, Then when you get into the car, your brain says, danger, danger, and your heart rate goes up. There are techniques of desensitization that can help you with that. Fears have excellent prognosis when they're treated professionally. Read my books and get professional help, and you'll see that it's not as bad as you think. Hi from Minnesota. Hi, Minnesota. How are you? How do you change your mind from anxiety state to logical? Anxiety does not work with logic. Otherwise, I would say, hey, don't be anxious. It's okay. Everything's all right. I'm here. It's okay. It doesn't work. Anxiety is a mind-body process. It's not just a mind process. So it has to be dealt with embodied methods, and then it works. But you can't talk yourself out of anxiety or out of fear. Hi from Ireland. My favorite second country. I love Ireland. Brilliant. Everything in Ireland is brilliant. I love it when they say that. What part of Ireland? I've been to many places in Ireland, but I love Dublin. I went to Bram Stoker's house in Ireland. He wrote Dracula. Okay. I am from New Jersey. My son and I have serious anxiety. All anxieties are serious, by the way. I think that's funny. That all anxieties are serious. So don't say you have serious anxiety, because they all are. Do you do private appointments? Yes, I do. Go to my website, biocognitive.com, and you'll see all the information there. All anxieties are serious because they hurt. They affect your life. But be aware that you may be teaching anxiety to your family. So get help and find out how you can unteach the anxiety. Chronic pain and severe depressive disorder and anxiety, what kind of advice? That's a major, major question. First, you have to find out what the chronic pain is coming from, the anxiety, what kind of chronic pain is it, and there are many techniques for chronic pain, by the way. So watch some of my videos and my books, and also there's quite a bit out there on I do specific technique on chronic pain. I've worked with neurosurgeons who dealt with people with chronic pain, and I teach in mind-body methods to deal with that. Okay, so are post-traumatic stress and anxiety the same? Well, anxiety is one of the symptoms of post-traumatic stress. Anxiety is one of the symptoms, but they're not the same. It's just like one of the symptoms. The other symptom of post-traumatic stress is you freeze when you see what's going on, your heart rate goes up, you think you're going to die. I had a patient, for example, when I used to call them patients, I call them students of wellness now, but he was a veteran from Vietnam. He had been in special forces. And every time he heard a helicopter, he would immediately go under a car to hide, because he had a reflex reaction that a helicopter meant that, they're going to shoot at you. So we worked through it, and not intellectual. Talk therapy doesn't work. It has to be mind-body methods. So we worked through it, and it took me quite a while to work with him, but he was able to change that behavior. Neuropathy in my arms, chronic pain. Okay, the neuropathy, you have to find out where it's coming from. Is it diabetes and other things? But there's some deep meditation methods that can help you reduce it deactivates some of the what's called nociceptors, which are the receptors of pain. So, but I can't give you a diagnosis without knowing you. It would be unethical, and I wouldn't be giving you real information. But there's a lot out there that you can get help. I have a phobia of fish. I have no idea where it came from. Do a meditation. Listen to one of my videos and tapes, or whatever, and then pay attention to what's going on in your body. Once you get into a contemplative state, find out fish. What is the association with fish? How did I feel about fish when I was in elementary school, when I was in high school? What happened with fish? And you're going to find most of the time that something happened that taught you that fish is danger. So your physiology responds to fish as if it were a snake. So there's a lot there. If you just started, first thing to do is to follow. Click the follow. House Shrink, clinical psychologist, talking about the psychology of fear and how to understand that fear is learned and it can be unlearned. Some fear is functional, which means that you should be afraid. A criminal comes to you with a gun to kill you, you should be afraid of that. But if you're afraid that every day you go out, you're going to find a criminal, then that becomes a dysfunctional fear. Even though some places are that way, some places are very dangerous. Por favor, ayúdame. Please help me. About what? What want me to help you with? In Spanish. And about 4 faces, laughing or crying in Spanish. Fear of failure. Oh, that's a great one. Fear of failure. Fear of failure comes, one of the ways that it comes, again, it was learned, and usually it comes when you saw failure in your family, not what they told you, but what you saw fail in your family. Or the fear of failure really also means the fear of being judged. And if you were judged inappropriately when you were little, and you weren't allowed to be wrong, you weren't allowed to use your own judgment, then you're going to be afraid of failing, but it's really being afraid of being wrong because it was painful to be wrong. And there are methods for that. Watch my videos. There's quite a bit. I have close to 200 videos now on YouTube, Dr. Mario Martinez. A lot of information. Deep breathing techniques help reduce my anxiety. Yeah, it does, because when you do deep breathing, you go to parasympathetic, which slows down the heart rate. And even better, if you do heart breathing, which is you breathe as if you're breathing from your heart, it creates a coherence between what's called between the brain waves and the in-between beats. And that is really a good connection of mind-body. So, whoa, that was helpful. Ayúdame, por favor. What do you want? Why are you speaking Spanish? Help me, please. Say it in English so everybody can take advantage of your question. So, if you just joined, the first thing to do, the ticket here is follow. Click to follow. If you're following already, the next click is share. And if you're doing both, then what you do is you let people know what's going on here and get them to join. You said about effect on nervous system. If one is alone, can you talk a little more about that? Can you be more specific? Because I can't remember exactly what I said about that, and I'll try to answer it for you. Meanwhile, if you just joined, the first thing to do is click follow. Very important. It expands my audience, and I'm able to reach more people, and you will know when I'm on, and then you have an opportunity to join or not join. So, House Shrink. My YouTube page is Dr. Mario Martinez. That's my name. House Shrink is my handle here. What are my thoughts on EMDR therapy? It's very good. It's got a lot of research that shows that it's really good for post-traumatic stress. But don't do EMDR alone. Do other kinds of therapies with it. One thing alone, like one technique alone, is not enough. EMDR is really good. And it's the eye motor desensitization. And what they do, many techniques where they teach you how to moving eyes or moving from one place to the other. But what it does is it decompresses the post-traumatic stress, and it begins to be expressed out. So yeah, I would say go ahead, and if you have a practitioner who does it, that would be very nice. My claustrophobia, my brother locking me inside a closet. Well, you see, that's what you have to do is you do a technique, and you sit, relax, contemplative, and you can watch my book, read my books and watch my videos on that. And then you imagine the time when your brother locked you in the closet, and bring back all the anxiety, and then you feel that you feel, and let it happen, and then say, okay, this is a cloud. Let it pass. Let it pass. Breathe and go back and do it. Breathe and go back and do it. And gradually what will happen, you'll desensitize the reaction to the stimulus, which is the locking in the closet. And there's much more that you can do, but I can only give you very small pieces here because I don't know your clinical history, so I can't diagnose you. I'm just giving you some techniques. But you can read my books, you can get help, and all of those fears and phobias have excellent prognosis if they're done with professionals who know what they're doing. Okay, if you just joined, you can see this video completely tomorrow on my YouTube channel, Dr. Mario Martinez. You can go there. I have over 500,000 people that have gone there already because the videos are very popular and they're very helpful because I'm giving you information here that would be very helpful. Okay, let's not get off the subject here. Stay on here. There's some people just going back, and stay with me. That's one of the problems that we have now. There's so much distraction that you can't stay tuned to one thing. After a while, you have to have your iPhone, or you have to have this, or you have to be funny, or be focused. And focusing allows you to ground yourself. Be focused, okay? Try it. If there are any clowns that need rehabilitation, you're welcome. What does that mean? That you used to be a clown, now you can be a serious person. And then you can learn. So you see, you're welcome. So any questions? New people, House Shrink, clinical psychologist, talking about fear and how it's learned and what you can do about it. And also to be able to watch this video tomorrow. I have it up the next day on my YouTube channel, which is Dr. Mario Martinez, and it's under Getting Your Life in Order. Why is fear so scary for people? If that's a joke, it was okay. But if it's not a joke, then why is this? Because it feels like hell. Somebody fear of being overweight, and well, I didn't get all the question done. Okay, now how do I become comfortable being uncomfortable? Stop joking around, and then you'll be comfortable. Do a cartwheel. Okay, there you go. See, you see how people jump into the minutia? They love that because you don't have seriousness, and we have a generation of people who are just fluffing. Stick with it. Get something out of it. It's all about selfhood, and it's free. I have a question. Go ahead, ask the question. Vinny, ask the question. How can I stop maladaptive daydreaming? What function does it do for you? What does it do for you? It takes you away from the present, right? What is your present like? Is there passion in your present? If your present is bad, then you're going to daydream. Find out what you need to do in your present to make it passionate, to have meaning for you, to have service, to have value. And the daydreaming will go away because your present will be more interesting than your daydreaming. It takes work. It was not a joke. Why is fear so scary? Well, because all kinds of things happen. When you're afraid, your heart rate goes up, and you think you're gonna have a heart attack. Your blood pressure goes up. Your skin resistance changes. Your temperature changes. You get cold because you have constriction of your vascular system, and your immune system suppresses. So there's a lot physiological going on that is very unpleasant. So that's why it's scary. Am I Jewish? No, I'm not. But what does that have to do with what I'm talking about? So stick on the subject. Stay with it. See, this is what I'm creating here is the. This is funny. The subcultural wellness of people that can stay focused for more than 5 minutes, and for people that can learn. Your moderator keeps on muting people for no reason. No, there's always a reason. When people are clowning around or trying to be cute, or religion or politics, they're muted. But if you don't want to be muted, then stick with the subject. Thank you for explaining the science behind it. Yes, it's very uncomfortable because you have a physiology. You have stress hormones. You have epinephrine or epinephrine, cortisol. There's a change in your endorphins and serotonin. A lot of things are happening, and it feels terrible. That's why. Okay, questions. If the clowns want to come back and want to have a reasonable question, then next time you'll be available. So why is it that we mute people when they're doing inappropriate things? Because you're disrespecting the audience and disrespecting me. It's that simple. Okay, now my cortisol is off the charts. Find out under what conditions, because cortisol is not up all the time. It's certain conditions cause cortisol to go up and down. It's a process that's contextual to a certain degree. And then find out what it is. How did you learn to have that level of stress? And then, of course, get some professional help, and you'll see that it'll work out for you. But yeah, always look at the context. Under what conditions this is happening. Why can't I stay sober? Well, that's not the right question to ask. What does it allow you to get drunk? What does it let you do when you get drunk? That's the question. I appreciate your patience with the clowns. Yes, and you know why I'm patient? Because I think that people, most people, not all, people, if they're given the opportunity to stop screwing around and becoming serious with themselves, most people do. There's some that are just not able. But do you think demonic possession and religion are related? Well, some religions will teach you that it can happen, like the Catholics and the Tibetan Buddhists and other religions, the Hindus. And I don't think that they're demons. I think that you have demons within you, your own evil or your own fear, or whatever, and it becomes a reaction. But that's another subject that I'll talk about later, because I have done a lot of work with stigmata and psychospiritual kinds of problems. Do you agree that anxiety affects differently depending on age? No, age has nothing to do with it. Forget age. Ageless. What happens is if you've been anxious for 40 years, it's going to do more damage than if you've been anxious for 20 years. But time doesn't do anything. Time is an affordance. It's the amount of time. But no matter how old you are, you can change anything. I'm going to drink some water. The clowns are drying my throat. There you go. Okay. Any other questions? If you just joined, House Shrink, Dr. Mario Martinez, clinical psychologist. Go to my YouTube channel. Follow here and follow my YouTube so you can have access to the information and you'll know when I'm on. My YouTube channel is Dr. Mario Martinez. What's the emotional counterweight to fear? Okay, fear is not courage. The opposite of fear is not courage. Fear has to do with a devaluing process, a devaluing self, and overvaluing what you fear. Overvaluing not is good, but overvaluing is having more power over you. So it's giving up your power to others. That's what fear. Fear is not the opposite. Courage, fear is not like that. It's valuation. Okay, now I'll let that one go. And serious questions? I'm about ready to finish up over here, so I hope that you can use this time properly. And for the clowns, if you want to join next time, look at how the time you're wasting and not dealing with real things here. And who taught you to be a clown? When people taught you not to be taken seriously. And how do you think your self-esteem is going to go up if you're going to be a clown? It doesn't work. Okay. Yes, somebody's doing some scientific study on anxiety. Great. Let us know what's going on. So keep following. Make sure that you follow. And if you've already followed, share. And if you just shared, make sure that you let other people know so we can spread the word. Why do you call yourself a shrink? I don't like the sound of that word. Well, you see, shrink is a funny word. Shrink is a psychologist or a psychiatrist, and it comes from the Amazon. There's some tribes that would shrink heads of their enemies, well, after they were killed, of course, and so they shrink the heads. And the popular concept of it is, I'm going to the shrink. Going to shrink my head. It's kind of analogous kind of thing. So I just do it because I want to take it lightly. I don't want to take myself too seriously. You don't have to be a clown, but you also don't have to take yourself so seriously that I'm talking here and I'm a psychologist and I know everything. No, just don't take yourself too seriously, but you don't have to be a clown. Shrink the problem. Okay, yeah. So that's what House Shrink is all about, and it's got a good popular kind of sounding. So it gets people to watch what I'm doing, but I don't take it offensively when somebody says you're shrink. It's okay, not a big deal. Okay, so if you just joined, before you leave, please follow, and then tomorrow you can go to my YouTube channel, Dr. Mario Martinez. What is the connection between fear and sadness? That's a really good question. Fear is the avoidance of something that might seem dangerous to you. The fear of something, the fear of losing something, the fear of being hurt. It's an aggressive process, avoiding an aggression or avoiding pain. Sadness is another emotion. Fear and sadness are separate. Fear is felt one way and sadness is felt another. Even facially, you can recognize it universally. Sadness is a sense of dysphoria. Your affect becomes melancholic, and there's a sense of loss. Sometimes with the sadness is that you're melancholic about something that you lost, that kind of thing. So I saw the shrunken heads of Waller Rock Museum in Battlesville, Oklahoma. Yeah, so now you know what shrinking is. The shrinking that we do is analogous, of course. It's metaphorical, so we don't shrink heads. What did you do the first 10 years after completing graduate school? A lot of thinking about what the hell I was going to do. I went into private practice, and I was doing neuropsychology in a neuropsychiatric hospital, and it was great for a while. But after a while, I thought, I'm working with people that already had the trauma, that had the brain damage. Some of them don't want to live. So I decided, okay, how can I move into wellness? How can I get people before they have the strokes and before they have all these other problems? So I use neuropsychology now in wellness, not in pathology. I'm always depressed but seldom sad. Do you have a difference between the two? Find out what it does with your body. Check your body. When you're depressed, what do you feel? When you're sad, what do you feel? And you're going to find out there's a little bit of difference, and there's some things that are similar. Okay, time to go. So before I go, follow the work. Let people know what I'm doing. And then tomorrow you can go, or today you can go, but this won't be up till tomorrow. I have over 200 videos now on YouTube channel for you to watch the whole thing. Dr. Mario Martinez, YouTube channel. So enjoy, and I will talk to you soon. We're going to have another one soon. I've been doing them almost daily. So I have a great following, and I want to thank you for following, and thank you for being so wonderful. Take care of yourselves. Bye-bye.